I'm Jim Newman. I'll talk to you today about how I manage shoulder pain. First off, important point is, did you have an injury to cause this shoulder pain? And if so, describe that injury and obviously how long ago it occurred. Secondly, have you been able to maintain your motion regarding your shoulder motion, that is? Because what you don't want to develop is a frozen shoulder due to this particular injury. Ideally, x-rays are important because if you have a fracture, you certainly wouldn't want to be pushing the motion. But once a fracture is ruled out, number one priority is gaining your motion. And oftentimes, once that motion is achieved, your pain is often a lot better. And in that situation, I think perhaps you were dealing with a little bit of a frozen shoulder. Other very common injuries are what we call impingement syndrome, and then when someone falls on an outstretched hand, they kind of suffer a jamming injury to the rotator cuff. Rotator cuff gets swollen and it doesn't function well, and its job is to depress the humeral head to keep that space within which it moves patent. And should it get weak and swollen, the space is compromised and you continue to rub on the bone above it, which causes significant pain, in particular at shoulder height. This is often brought on with repetitive motions as well, in particular workers working at shoulder height repetitively. You could also develop a rotator cuff tear with that type of occupation or the prior injury I mentioned. And if you do have a rotator cuff tear, it is very difficult to discern that versus impingement syndrome by the patient, because they'll hurt the same, because most rotator cuff tears are functional rotator cuff tears, meaning you can function quite well, you just have pain, in particular night pain. And that's one of the reasons we're pretty quick to get an MRI scan nowadays to rule out a significant rotator cuff tear, because if you do have a rotator cuff tear, 0% heal without surgically fixing them if they are full thickness. If that tear is greater than 50% thickness, they typically go on to fail, and that's another reason to be a little more aggressive with treatment, meaning surgery. For impingement syndrome, on the other hand, or any partial thickness tear less than 50% thickness, you typically get better with a course of physical therapy working on rotator cuff strength, as well as some non-steroidal anti-inflammatories, and then sometimes a subacromial steroid injection. Ideally, we usually start with physical therapy even when we're suspicious for a full thickness rotator cuff tear. But the problem can be, if you start getting better, does not mean you're out of the woods, because with activity modification your pain can be diminished despite having a full thickness rotator cuff tear. So as I previously stated, MRI nowadays are pretty quickly obtained. That leads me to arthritis, which is also a reason for shoulder pain, and usually you start losing a little motion due to the arthritis of the shoulder joint. Treatment for that typically is a little bit of physical therapy, although too much strengthening can aggravate the arthritis, and end-stage treatment for that is some type of shoulder replacement, and there are various options. One is just resurfacing the ball, the other is doing the ball and the socket, and the third is what is called a reverse total shoulder replacement, which is done when you have a massive rotator cuff tear and severe arthritis. So that's all I have today for shoulder pain and how I manage it.